I want to ask Dr. Wahls something that I think is really fundamental to everything we're trying to do, and I need to give a little background. Dr. Wahls had practiced for many years at the Veterans Administration Hospital in Iowa City, where she had a functional medicine program that she called the Therapeutic Lifestyle Clinic, I believe.
Mm-hmm.
The reason this is really critically important is that while this is a special group because they are veterans, yet they are everyday people. They are everyday people who eat like many Americans, sleep like many Americans, move their bodies, sometimes more, sometimes a little less. So while I know that Dr. Wahls has thousands and thousands of dedicated followers who have deeply connected to her message, this is maybe a slightly different population because this is, quite frankly, more like the average American.
Oh,
you know, 330
absolutely.
million of us, and most of us don't necessarily know all of the things that Dr. Wahls has to teach and to share. And so I'm so interested in that group of individuals because this may be you, if you're watching this video, this may be you just saying, you know, maybe watching it with a certain degree of skepticism, even saying, really? That if I change the way I eat or I work on my stress and have a daily practice of kind of being in the moment and calming my brain and my body, that will actually change this disease? Don't I absolutely need these medicines all of the time and for an indefinite period? So if you're watching this, if you're thinking about this, I hope that Dr. Wahls will take a few minutes to talk about how she connected to these veterans and brought them into this program and taught them to make these changes in lifestyle that ultimately took at least half of them down a road that, you know, of resilience and wellness and vitality.
Yeah, so let me sort of give you the background. So I was at the Iowa City VA, and I'd been invited by the Chief of Medicine and the Chief of Staff to create a lifestyle clinic, which we did. And people could be referred to the clinic by their primary care doc or specialist physician. The requirement was the patient needed to understand we were just going to use diet and lifestyle. They could come with a mental health problem, with a neurologic problem, with a medical problem, with an autoimmune problem. And the most common reasons that people came to see us, probably 60% of the folks had severe pain. Fatigue was also very common. Brain fog was very common. About a third of our folks had some sort of mental health problem. 25% had some type of autoimmune problem. Things like polyneuropathy, a wide variety of neuropathies, pain from previous surgeries or war injuries, very common, obesity, diabetes, metabolic syndrome, heart disease, then of course a bunch of things, some Parkinson's, early cognitive decline, some early Alzheimer's, MS, lupus, fibromyalgia, rheumatoid arthritis, scleroderma, mixed connective tissue disease. So I hope you're getting the sense, a wide variety of health problems. In our first class, I would tell my story. We'd have pictures before and after. I would explain the principles of functional medicine. We'd talk about the microbiome, gene expression, toxin exposures, hormonal balance, and that we could address these things using diet and lifestyle, and that we could be optimistic about our ability to improve function, improve energy, reduce pain. And then we'd give the audience three choices. One is to say, that's too hard, I can't do that, this is not the right time for me. And they'd go back to their primary care specialist doc. The other is to say, you know, I'm interested, but I'm not quite ready to commit 100% to do the diet you recommend. And they could work individually with our dietitian and improve the quality of their diet at the speed that they're willing to improve it. Then the next thing would be to commit to 100% gluten-free, dairy-free, lots of vegetables for 100 days. And then they would come and spend a half day with a very intensive education-oriented program, a couple hours with me as the physician, a couple hours with the dietitian, and we'd make cooked greens, we'd make green smoothies, and we'd help them reimagine their relationship to food. And they would begin. And then we'd see them every 6 weeks for the next year, and they would be coming into the group class, we'd do some education, we would do peer-to-peer teaching, and people would steadily experience declining blood pressure, if their blood pressures were elevated, declining, improving blood sugars, weight loss without being hungry if they were overweight, and pain would steadily decline, function would improve. And we saw that time and time again across many disease states. Now, many of my physicians, colleagues, it would drive them crazy that I'm using the same approach for all these disease states. They thought that was surely snake oil. But because we had so much success, the physicians, the specialists, the rheumatology docs, the neurology folks, the GI docs, the skin docs started sending us their toughest cases. They would ask their difficult patients who were struggling to get control of their illness, are you interested in the lifestyle clinic? It's going to be diet and lifestyle, but we've had great success. And
right.
So we're seeing very challenging cases. And of course, some of them would be like, no, this is not the right time. I can't make those changes.
Right.
But the people who would make the changes would see phenomenal difference, and they could see differences within as early as 6 weeks. Not that things were gone, were resolved in 6 weeks, but it was the first time they could see symptoms reducing.
Absolutely.